Well, the flu often starts off with temperature, aches and pains, feeling unwell, sneezing, those sorts of typical, if we can call them cold-like symptoms. The difference is that the flu continues to get worse and patients will ultimately develop some quite severe complications from influenza that does result in them going to hospital and potentially ending up in intensive care unit.
So generally we see the most serious cases coming to emergency because the more minor ones are dealt with in the community, either see their GP or actually don't even go to hospital at all. But we do see a lot of sick people with flu as well, and especially last year, which was a very serious outbreak of flu, we were inundated with people. The most notifications are in the young age group, 0 to 5, and the older people, 85 plus. The reason for that is that if you're a fit, healthy adult, then you may not even know that you have the flu. It could be a fairly minor illness and you might go about your daily activities, have one day off work and not actually realise how severe it is. The problem comes though is if you're in the younger age group, especially under 12 months or under 2 years old, and you get the flu, you can get very unwell, not eat and drink and end up with pneumonia. And the alternative too is at the other age spectrum is if you're 85 plus, you might have underlying heart disease or get flu and have a fall and break your hip, and so this ends up being a much more serious illness than in a fit and healthy adult.
There are two reasons why you should get flu immunisations, or two broad reasons. One, for the individual. So there are a group of people, which includes children, pregnant women and older patients who, if they do get the flu, can potentially die. Also, younger people who don't necessarily at greatest risk of getting severe illness, don't want to spend long periods of time away from work or study or be sick for long periods of time. We don't have great treatment for influenza once it sets in. There are antivirals, but they don't work as well as prevention.
Last year, we were very fortunate because, they didn't get sick, the girls. I actually decided to give the vaccination to both of them. The little one actually had to give her two shots because she was under 8, so you need to do, the first time you do it, you have to give them 2. But so they didn't have any side effect or anything after having the vaccinations. And they didn't get sick, and in my eldest class, pretty much half of the children or more had the flu, and she didn't. So very very good results.
I have had the flu, and it was before the flu injections came out, and I was really sick. Really ill. But I've had the flu injection every year it's been available since.
One of the commonest comments I get is that the flu shot gives me the cold. So I have patients who say that they got a flu shot last year and they had the cold continuously throughout winter, and they presume that that's the flu injection. The flu injection stops you from getting the flu. It doesn't stop you from getting colds.
Well, the most important thing is to vaccinate, and vaccinating children is excellent, and also older people, and there's programs for that. But if your workplace offers vaccinations for flu, then it's really important to do that, because it's often these healthy adults who are the people who transfer the flu to other age groups. So if your workplace offers vaccinations for flu, it's really worthwhile getting it. Even though you may not have a particularly serious illness with it, it can stop the spread to your younger children or to your older parents, and that's really important.
I think there's compelling evidence to show that without it we could become very ill and finish up as a statistic. I don't want to finish up in hospital on a ventilator, and I feel that it's very unfair to your family, friends and neighbours not to have a flu injection, because you could be spreading your germs to them.
There are 3 groups that can get the flu vaccination for free. New South Wales Government have announced this year that they will be immunising children under 5 years of age for free, and the Commonwealth Government will pay for free flu vaccinations for pregnant women and people over 65 and patients who do have a significant medical problem.
If you're over 65, please go to your GP and have a flu injection. And don't forget, if you're over 65, they're free of charge.